There were a lot of pharmacy practitioners burnt out during COVID and post-COVID because of the significant increase in immunizations and patient care that they were providing. And so really looking to see how can we help influence the workforce environment, and also showing the impact of a community pharmacist in the communities they serve.
Paging Dr. Cook. Paging Dr. Cook. Dr. Cook, you're wanted in the OR. Dr. Cook, you're wanted in the OR.
Welcome to the Prescription for Success podcast with your host, Dr. Randy Cook.
Hello, everyone, and welcome to Prescription for Success. I'm Dr. Randy Cook, your host for the podcast, which is a production of MD Coaches, providing leadership and executive coaching for physicians by physicians to overcome burnout, transition your career, develop as a leader, or whatever your goal might be. Visit MD Coaches on the web at mymdcoaches.com, because you're not in this alone. My guest today is not a physician, but she represents a part of the healthcare team that physicians absolutely could not function without. She currently holds the position of chair for the Division of Pharmacy Practice and Science at the Ohio State University College of Pharmacy. So let's hear my conversation with Dr. Bela Mehta. It is such a pleasure for me today to be doing something that we've never done before on Prescriptions for Success. We have interviewed a lot of healthcare professionals from a lot of different backgrounds and specialties and things of that nature. We've even interviewed insurance salesmen and this and that. But today, we're interviewing a pharmacist, and it is my pleasure to be in conversation with Dr. Bela Mehta from the Ohio State University. Bela, thank you so much for being here, and it's really a pleasure to have you on Prescriptions for Success.
Oh, thanks so much for having me. I'm happy to have the opportunity.
Well, I'm really looking forward to this. As I mentioned, it's new territory for us, and I bet it's going to be a lot of fun. Hope it will be for you. And as we always do, let's begin by talking about your beginnings. I know that you are a native-born American, a native-born citizen, but there's a little more to the story than that. You want to tell us about those details?
Yeah, absolutely. My father came to the U.S. in the 1960s. There was an Immigration Act that had passed in 1963 allowing citizens from India to come to the U.S., where there was a shortage of engineers and doctors. And so my father took advantage of that. He came here for graduate school. So he came by boat from India. He came on the Queen Elizabeth II and sailed.
Wow.
I was, he got the opportunity. It took a couple weeks to get there, and he was able to travel through Europe through the process, and then landed in New York with the very typical immigrant story of, having $8 in his pocket and very little with him. And he went to graduate school at the University of Missouri, Columbia, and the Rolla campuses, and studied there. And it was a monumental thing at the time to travel overseas
Really.
and come by himself with no family and no easy way to communicate with family back home. And so I'm just very fortunate that he did that.
And you actually spent some time in India yourself, did you not?
I did. So
Let's hear that story.
Yeah, I was born in Akron, Ohio. So I'm a native Buckeye. But when I was 6 months old, my parents decided to move back to India. They thought, as they were raising a family, that having family close by would be important. But after
So that was actually going to be a long-term thing.
it really was. But after a couple of years there, my parents decided that there were more opportunities, and they really wanted me to get an education in the U.S. So I lived in India from about 6 months old to about 4.5 years. So my formative years, my early formative years were in India, and then we moved back to the U.S.
And one of the things that fascinates me about Indian culture is that there are lots of languages there, and English is fairly commonly spoken.
Mm-hmm.
But did you take the opportunity? Did you experience being able to take on some of those other languages, or at least maybe one or so of those
I
other
would
languages?
say, yeah. So I would say I'm conversational in Gujarati, which is the language from the state of Gujarat, where our families are from. But I'm totally illiterate. I can't read or write Gujarati, but I can hold a conversation. So
Yeah.
at least I can communicate with family, and many of them speak
It's a
English.
pretty cool story.
Yeah. Thank you.
So the next question, I guess, is at what point in your life did you develop an interest in becoming a pharmacist?
Yeah, when I was in high school, I was a junior in my biology class. I can distinctly remember my biology teacher one day talking about how fascinated he was and how impressed he was with his local pharmacist and how much they knew and what what knowledge base they had to store. And so as a junior, I started working at a local independent community pharmacy in Westerville, Ohio. And it was the owner and his wife, and he ran this pharmacy, but was really, really integrated into the community. And so I
And
got
what
to
exactly
see.
was your job at that point?
Yeah, so I did a little bit of everything. I mean, I ran the cashier and stocked the medicines, but then I also, when I had my license, then I was able to drive and do deliveries to. He had a contract with a drug and alcohol rehab center where we sent unit dose medication. So I was able to. I essentially worked as like a pharmacy technician in my role, and then also made deliveries to the local nursing home. So got to know a lot of the patients and folks that were living there. So developed some relationships because this pharmacist was able to model the relationships that he had in the community.
Hi, I'm Rhonda Crow, founder and CEO for MD Coaches. Here on RX for Success, we interview a lot of great medical professionals on how they grew their careers, how they overcame challenges, and how they handle day-to-day work. I really hope you're getting a lot of great information. But if you're looking for an answer to a specific problem, management or administration challenge, or if you're feeling just a bit burnt out, like maybe you chose the wrong career, well, then there's a faster way to get the help you need. No, it's not counseling, it's coaching. RX for Success is produced by MD Coaches, a team of physicians who have been where you are. I know you're used to going it alone, but you don't have to. Get the support you need today. Visit us at mymdcoaches.com to schedule your complimentary consultation. Again, that's mymdcoaches.com, because you're not in this alone.
We'll get back to our conversation in just a moment, but first, I want to mention a sponsor who has been with us almost since our beginning. Physician Outlook is a splendid publication created for physicians by physicians. Originally a print and online magazine, it's now a dynamic digital-only platform using storytelling, humor, and community building to help physicians and surgeons reconnect with the art of medicine. Physician Outlook celebrates the entire healthcare team, including nurses, nurse practitioners, and PAs who value physician-led care. As artificial intelligence and corporate overreach threatens the human connection, Physician Outlook remains committed to the sacred physician-patient relationship. Beyond storytelling, Physician Outlook takes action on causes that matter. So join the movement, connect, laugh, be inspired, Visit physicianoutlook.com today. And now let's get back to our interview. So that's where the seed was planted, and it really began to take shape when you matriculated into the Ohio State University. You want to tell us how that worked?
Yeah. So I applied to Ohio State, and at the time it was and still is a top 5 college of pharmacy here in the U.S. And so I knew that I was getting a really good experience by coming here to Ohio State. At the time, it was a bachelor's in pharmacy program, so you could either apply to do 1 year of pre-pharmacy, 4 years of pharmacy school, or a 2-3, where you did 2 years of pre-pharmacy and 3 years of pharmacy school. So I did the 1-4, graduated with my bachelor's, and knew that, through that experience that I got to rotate in a federally qualified health center, and really, really loved that experience. It felt like I was giving back to the community. The patients were really the working poor, so they made just above the poverty level, but didn't qualify for government assistance. And so the role of the pharmacist was really to help the physicians and medical residents that were there in helping choose the right drug for the right patient at the right dose at the right time, being able to counsel those patients, but then also really helping with the medication access and use portion of it. And so I knew that I wanted to do something like that. And so I went on to get my doctorate and did the Pharm.D program and then a residency after.
So it sounds like once you complete the Pharm.D that there are actually perhaps multiple opportunities.
There
and
are.
What you chose was ambulatory care. Is that? Yeah.
That's right. So when I graduated, there really mainly everybody who went on to become a registered pharmacist did the 5-year bachelor's program. And then it was optional to get your doctorate. So I was one of, out of my class of 120, I was one of 3 that chose to go on and get a Pharm.D. And so it was a little bit unusual at the time. My class size was only 18 students, so it was very small, and it was one of the largest. It was the largest class, the largest classes that they had at the time. But today, we have an entry-level Pharm.D program, and so you can get a bachelor's in pharmaceutical sciences that would allow you to go on and get another graduate or professional degree. So depending on whether you wanted to go into drug discovery, research, industry, or if you wanted to practice direct patient care, there are different pathways. Most of our students in our bachelor's program go on to our Pharm.D program. So about 50% of them go on to get a Pharm.D, which is another 4-year program. But some of them choose to go to medical school, dental school, optometry school, because they have then the pharmacy foundation before they go on. The doctorate program is a 4-year program, and then our residency and postgraduate training is optional. So it's anywhere from 1 to 2 years. So if you want to do direct patient care, if you want to go into academia, or perhaps you want to do research, you might choose the optional postgrad training.
Correct me if I'm wrong, but I had the feeling earlier in our conversation that in the very beginning, you really thought that a more clinical professional career was where you were headed, but yet you made the decision to go into academia. Am I misreading that?
No, that's right.
Can you give us some details?
Yeah, absolutely. So during my Pharm.D program, actually, we were required to do a 6-week teaching rotation. And so that's where I got interested in the academia part. I really was drawn to that federally qualified health center, ambulatory care, something community-based pharmacy-wise. And so I did apply for a residency, and I was the 3rd resident to graduate from our program program here at
Wow.
OSU. So it was fairly new at
A
the time. Really.
trailblazer, yeah.
Yeah, it was novel at the time, but it combined my passions of ambulatory community pharmacy, but then also there was a strong teaching and research component as well. So I think that really solidified that I wanted to be able to have the best of all worlds, where I could do direct patient care, but then also be engaged in the classroom.
So when you moved into that position as clinical assistant professor at The Ohio State University, did you feel like, wow, this is what I've been planning for, or did you have any misgivings, or what was your state of mind when you stepped into
Yeah.
this world?
So when I was done with my residency, there really weren't any faculty positions. My husband was still in his family practice residency training, and so I needed something as a gap position. And so I was able to teach for 1 quarter. I took a faculty position to essentially cover some teaching and then cover maternity leave. And then a long 1 year position became available to cover, again, in a few different ambulatory care clinics, and then teach 2 or 3 different classes in our curriculum as we were transitioning from the bachelor's to the entry-level Pharm.D. And then I was really fortunate that a clinical track faculty position opened up in 2000. And so I was able to apply, and I successfully got the offer for that position, and became the first faculty member that was shared faculty with CVS Pharmacy in the country. And so my job was to get clinical services up and running at one store to be able to develop the model for other CVS pharmacies.
I'm impressed with that. Did you understand at that point that you were sort of at the beginning of something really huge, these mega pharmacy corporation things that I can't
Yeah.
say I'm really a fan of?
Well, yeah, it was very new, very novel. I will say that, about a year into the role, CVS had a change of heart at the time, and so they decided to go in a different direction. And so, lucky for me, I ended up joining. I became part of a clinic that I went on to become director for, where I had so many opportunities for 15 years to really develop and implement clinical services that were very transformative for me and for practice. So it ended up being the right thing that they decided to go in a different direction, and I went in a different direction. And I learned a lot through the
Yeah,
process.
yeah. Well, let's go back to the direction that you went. You want to
Yeah.
take us through the step by step of how you landed
Sure.
a position as chairperson?
Yeah, sure. So I for 15 years or so, I was director of a community-based clinic. It was the first anti-coag clinic at OSU. It was the first one to have contracts where we were getting paid for some services for employees. And I loved patient care, but after about 15 years in the same role, I really wanted to do something different. And so we sunsetted the clinic, and I took over as director of continuing professional development, which I don't know that I necessarily envisioned myself in that role, but I learned a lot
Yeah.
about education and processes and technology and how to get a program up and running from the ground up. And during that time, we had some restructuring here at the College of Pharmacy, and an opportunity became available to become a department chair for pharmacy practice. And I was fortunate that, in my first portion of my career, I had the same department chair for 15 years. And he was really a role model and a mentor. And he said, you really need to throw your name in the hat for this. It's the right time. You can do this. And so with his encouragement, and I talked to some other mentors here and around the country who really said, here's some things to think about. And they really gave me the encouragement, and I'm so glad I did it. It it was probably the best decision I made in my career because I love what I do. I love the people on my team and that I get to work with every day. And it's exciting to help lift others up and help develop them and see what's on the horizon for them.
I can hear the excitement in your voice. And
Yeah.
if you don't mind,
Yeah,
just enlarge on that a little bit. Tell me what
sure.
you're seeing and what you think the future is like and
Yeah.
the things that make you excited.
So we have a new dean who is her second year here at the college, and I've worked with many deans over my 27 years here, and this is the first time that our strategic plan actually has a pharmacy practice pillar as part of the strategic plan, which I'm able to lead. And so we have three aims that we're really focused on. One is to make sure that as a College of Pharmacy, we're helping patients get access to medications. And so we're really focused on expanding rural medicine and urban medicine opportunities. So focused on some expansion through our faculty, our postgraduate trainees, and then also looking at exposing students so that they are also excited about going and practicing then when they graduate in some of these rural and urban areas. And then we're also looking at influencing community pharmacy change. So I think, we saw during the post-pandemic time that there were a lot of pharmacy practitioners burnt out during COVID and post-COVID because of the significant increase in immunizations and patient care that they were providing. And so really looking to see how can we help influence the workforce environment and also showing the impact of a community pharmacist in the communities they serve. And then our last aim is really focused on showing the impact of a pharmacist on value-based care. So looking at when you have a pharmacist as part of that team working with physicians and nurses and other providers, how are we able to help with the quintuple aim? So looking at how does having a pharmacist impact patient satisfaction, well-being of providers, medication access, cost of healthcare. And so really looking at that impact or value that the pharmacists bring. So I'm really excited about all three of those areas.
One of the things that stood out to me in looking through the biomaterial on you is that you have an interest in complementary and alternative medications and herbs. And I'm going to have to tell you, that really took me by surprise.
Yeah.
And not that I have, and I really don't have any negative judgments about it, but I've always seen pharmacists as being the purest of pure scientists.
Right.
And this kind of takes us into
Yeah.
the unknown area, and I'm impressed. Number one, that there are people in positions like yours that are able to be somewhat open-minded about that. So can you just
Sure.
talk about where your feelings are on that subject?
Yeah. I grew up in a family that used Ayurvedic medicines. And so I grew up in a home that my parents would give me these awful tasting brown, bitter herbs for just about everything. And I really didn't like them. And, I went to pharmacy school and I was the typical person back then who was like, I'm not recommending these. I don't know what's in them. I don't know how they work. But really during my residency and in my initial year as faculty, I had a lot of patients asking me questions in the primary and ambulatory care space. And I realized I just didn't learn about them. I didn't know anything about them. And so I applied for some grants and I did some work in learning more about what is evidence-based medicine with integrative medicine, with herbs and dietary supplements. And so I started a service to really look at, from a pharmacist's vantage point, what are the drug-herb interactions? What are disease-herb interactions? And so I was able to approach patients not in a negative way, but saying, here are the supplements that I know you're interested in taking and the medications that you're on. Here are my concerns, and here's how they might help or not help in terms of what the literature shows. So I really took an evidence-based approach to it. And at the time, OSU was just developing some of the research and scholarship in that area. They just celebrated the 20th anniversary of their Center for Integrative Health and Wellness, and I was really proud to have been part of those conversations from the beginning, from when that was being developed, because I do think we have a really good evidence-based approach to it, and more patients are using and asking about these products. We also teach it in the health sciences curriculum. It's part of, our board of pharmacy exams that are given nationally. They ask pharmacists to know about major interactions and major conflicts, or what the studies show. And so we teach it to our pharmacy students as well. And I think that's important, that they know where to go to, what are the best resources, and what does the evidence show.
I think that is really cool and really a very conscientious and I think properly scientific way to approach it. People have made it clear that they can be persuaded to take things for their health that so-called medical professionals might not feel really have any basis in reality, and to take the time and the effort to take a good hard look at it and see if there might be some truth there, I think is really the responsible thing to do. And I congratulate you for doing so.
Thank you. Yeah, it's been a lot of fun.
There's something else that turned up in your CV that caught my eye, and that was that you have shown an interest in provider burnout. It will probably come as no surprise to you that a lot of physicians are going to be wondering what could cause a pharmacist to be experiencing burnout.
Mm-hmm.
I have some ideas of my own, but I really want to hear it from someone who's seen it.
Yeah, it's interesting. The work that I was doing in this topic really started pre-pandemic, so in 2018, 2019, and the reasons for the burnout were very different. It was really, a high number of prescriptions, no lunch breaks, no restroom breaks, a lot of metric-driven healthcare that we were seeing in all aspects of pharmacy. And so we started doing some research. I worked with some graduate students and residents to start exploring, what does well-being and resiliency and burnout look like? And we did some projects in health systems pharmacy. We did it in community pharmacy, really to explore the issue. And I think when the pandemic hit, I think it all just magnified, because now all of a sudden, you're being asked to do more with less resources. There's turnover with staffing support, even more expectations in filling prescriptions. And I think, some left the profession. And so I think that even warranted even more exploration of what do we need to do, and who do we need to really have in the room to help make changes that are meaningful. So I was part of a group that developed some national consensus guidelines for the pharmacy profession. So you had practitioners in the room, you had regulatory agencies, employers, large pharmacy associations, really talking about, from each vantage point, what are the top 10 things that we should be doing? So from a curriculum standpoint, from an employer standpoint, and it all really came down to making sure that patient safety was, the primary focus, and then also provider well-being. And so I think that there has been a lot of work in that area, but I also think there's quite a bit more work to do in that area as well.
I think you're dead right on that. Now that I am in my 8th decade of life, I make fairly frequent trips to the pharmacist. And when I look into that workspace, I see one pharmacist and quite a few techs scurrying around as fast as they can. The pharmacist's eyes are glued
Yeah.
to the computer, and something on their face says, I don't know if I can do this anymore.
Yeah.
And that kind of makes sense to me. I bet a lot of people that go into pharmacy think there's going to be some human contact, and yet they're just feeding the computer. Is that kind of at the root of the problem, or is it bigger than that even?
I think community pharmacy in particular has really seen a lot of changes over, especially the last few years. In the state of Ohio, in particular, we're seeing a record rate of community pharmacies closing. So last year alone, there were 215 pharmacies that closed in the state, and for the first time in any memorable history, we're below 2,000 pharmacies, and that includes independent pharmacies, chain pharmacies, so big and small. And what we're concerned about is that patients, sometimes the pharmacist is the closest healthcare provider that they can access, and that's really their triage point. So these community pharmacists are the ones saying, okay, I'm really worried about the symptoms that you're telling me about. You really need to go see your physician. And so most Americans, 89% of the U.S. used to live within a 5-mile radius of a community pharmacy. So when we see these record number of pharmacies closing, we're really seeing these pharmacy deserts pop up where now, patients maybe have to travel 20, 30, 40
You
minutes
bet.
away to
I live
to
in
get
one
a,
of those.
yeah, to get a
25-minute
prescription.
drive to my pharmacist.
Yeah, and that's really a concern, is looking at making sure that patients have access.
Well, Bela, I have really enjoyed this conversation. I knew that I would, and I never get tired of poking around in the areas of healthcare delivery that I really don't have much experience in. And this has been a good one. This has been a good experience for me, and I think it probably will be to our audience as well. That said, I think we have come to the end of our conversation, and we're going to get to what I think is the best part of the show, and that's when I get out of your way and let you speak to our audience on your own. So, audience, here is Dr. Bela Mehta to tell us her prescriptions for success.
Thank you so much, and thank you for this opportunity. I thought a little bit about my career and what I've reflected on and where I've learned the most and grown the most. And so I wanted to just share four different things that I think are my prescriptions for success through my career. And I would say that first and foremost is really that who you surround yourself with is probably one of the most important things that I've learned, that relationships matter. And so you want to personally and professionally surround yourself with people who care about you, who are there to support you. And so in the professional space, I always say it's my mentors, both within my institution, but also around the country that I've been able to meet through professional organizations that have helped guide me in kind of the hills and valleys of my career. And so I think mentors are really important, but then also having your own network and your people that are there to help support you. I think professional changes happen, career changes happen, and you really want to think about who is there to help guide you. Who do you trust? I also think that, in my career, as I've ebbed and flowed through different roles, that I've really learned that finding your purpose is really important. So what is it that drove you into healthcare? So for me, what made me passionate about pharmacy? Because I want to make sure that every day I'm doing the things that bring me joy. I want to wake up every day and really enjoy going to work, both to do the things I do, but with the people that I'm around as well. And I've been able to really ebb and shape in my career by taking advantage of some of those opportunities, by thinking about what is it that's going to bring me joy in the things that I do. I also learned, from mentors that leadership comes in many different forms. And so there's big L leadership where you have a formal title, and there's little L leadership where you can influence and role model and impact change in many different ways. And you don't have to have a formal title or a formal position to be a leader. So think about engaging in leadership early in your career, often in your career, and influencing in many different ways. And then the last thing that I learned during residency is that I think that many of us that go into healthcare, we have this bar that we set, and we know that we're going to hit one marker after another. And so early in our careers and in our educational paths, there's a lot of successes, a lot of graduations, a lot of certificates, a lot of awards. But as you get further in your career, I think sometimes we forget to celebrate some of those successes. And so I during my residency, had a residency director that said, we celebrate all successes, big and small. And so I've tried to do that in my own leadership path as well. And so I think those are really important. So any reason to eat cake, but celebrate the successes. And I would say those are really my 4 prescriptions for success that I wanted to share.
Outstanding. Surround yourself with good people. Find and know your purpose, know your capacity to lead, and celebrate successes, the big ones and the small ones.
Yes.
Lots of wisdom there. Bela, I thank you so much for sharing that with us, and I thank you so much for being with us on Prescriptions for Success. Before we go, I want to give you an opportunity to share anything other information about yourself that you might like to offer, email addresses, Facebook pages, any presentations, if you're going to be on Broadway, whatever. What would you like to tell us about?
No, I'm happy if anyone's interested in pharmacy or interested in collaborations or interprofessional work that we can do. I'm happy to be a resource and connect you. We have excellent folks here at Ohio State, and I'm happy to answer any questions as well. I can be reached through my OSU email, which is mehta.6@osu.edu, and I'm available on LinkedIn as well. But thank you so much for this opportunity today.
Thank you so much for listening today. If you enjoyed the show, you can help us reach more listeners by leaving a rating and a review, especially on Spotify or Apple Podcasts. And if your app doesn't have that option, just leave us an email or a voicemail through SpeakPipe at www.mymdcoaches.com/podcast. You can also help by becoming a Patreon member. That link is in the show notes. And we hope you'll also follow our companion podcast, Life-Changing Moments with Dr. Dale Waxman. Special thanks to our producer, Craig Clausen, our promotions manager, Mariana Rodabaugh, and to Ryan Jones, who created and performs our theme music. And remember, be sure to fill your prescription for success with my next episode.